Behind me is Jackson Memorial Hospital, and we're about to head upstairs to the Jackson Heart Institute to talk to Dr. Mallidi and find out what they're doing here to keep you heart healthy. As promised, I'm now joined by Dr. Mallidi of Jackson Heart Institute. Doctor, thanks for sitting with us today.
My pleasure.
So tell me, what is Jackson Heart Institute?
The Jackson Heart Institute is the cardiovascular service line for the Jackson Health system.
And who is this for? Who are you seeing the most?
Over the past year, we've seen plenty of patients who were told that, well, we can't, really, there's nothing we can offer. And often it's the doctors themselves that call us and say, well, we can't really take care of this patient here. They're too sick, they're too complicated. Our hospital isn't, geared for this kind of stuff.
Yeah.
And we accept the patient and do the best that we can, knowing that what we have to offer is not sort of possible at a lot of other places.
What are some of the innovations that you see here, or what are some of the cutting edge of what's happening here on a regular basis?
So in terms of the Heart Institute activities, the areas of focus that we're trying to develop are really in three different broad areas. One is in the heart failure transplant VAD space. And another is in sort of developing a complex or aortic surgery center of excellence within the Heart Institute. So these are patients that have a problem with their aorta, which is a big blood vessel that comes out of the heart. And often you'll hear about people with aortic aneurysms or aortic dissection. And the Heart Institute or Jackson Memorial has always cared for these patients. It's nothing new. What's different is really sort of going beyond and becoming more focused on offering sort of the latest therapies, the latest techniques, and taking care of sicker patients.
I've heard about a new term to me today, which is redo surgery. What is that, and how does that play a role here in what you're doing at the Heart Institute?
Because the results of surgery are getting better and people are living longer, so patients who've had surgery 10, 15, 20 years ago, they, if they had a valve replacement 20 years ago, the valve is wearing out and they need something else done now.
Who's a good candidate, and who watching right now would you encourage to come here and find out more about either themselves or get checked out?
I think anybody that is worried about, decreasing exercise capacity, anybody who's worried about shortness of breath or chest pain, who's dizzy. But it's important that people understand that we take care of all patients, whether it's just basic diagnostics or whether it's somebody that needs the most complicated redo heart transplant. We will take care of you.
Doctor, if people would like to find out more about what you're doing here, how can they do that?
I think the easiest way for people to get more information is just to go online and visit our website. They can get the information that they're interested in and learn more about their heart disease as well as the Heart Institute.
Great. Thank you so much for your time.